Hi there, welcome back to my channel. If you are new here, my name is Adim Awe. I'm a licensed mental health therapist and a forensics evaluator for the purpose of immigration cases. And what that means, if you haven't watched my videos before, and by the way, make sure you subscribe and like this. For the case of immigration cases, often what happens with your attorney, and maybe you're not working with an attorney because you decide you want to embark on this journey, independently because of financial reasons or because you have great confidence in your abilities to get through the legal process that is immigration here in the United States. Kudos to you if that is the case. You decide to go file for a hardship hardship waiver. And so what happens is often your attorney will encourage you to speak with a licensed mental health professional like myself, which can be licensed clinical social worker, me, licensed marriage family therapist, licensed practical counselor, licensed clinical psychologist. We all, we have different purviews per our licensure, but what we will do is evaluate you regarding the hardship that you're claiming, right? And so what happens in these cases is that when we meet with you, what we're going to do is collect lots of information regarding what's going on, the impacts of said hardship, right? So what often happens is there may be an impending removal for somebody that you love. Perhaps that's your spouse, perhaps that's a child or whatever have you. And so as a result of that, you are stating that you are going to be facing this hardship or you're facing this current hardship at this time. I want to give the disclaimer that I'm not an attorney. This is not legal advice in no way, shape, or form. I always encourage people or clients that work with me to work with an attorney, but it's not absolutely necessary that you have to because, again, I understand the barriers. We understand the barriers that sometimes can happen in trying to obtain an attorney, but I do always recommend it, and I just want to give that disclaimer. So I want to give information today regarding the hardship assessment, if you will, or the rubric, or what we're looking for from a mental health perspective in order to help your case. Now, these tips do not guarantee that your case will automatically be approved. You'll be granted a green card. I'm not claiming any of that, but I do want to just set you up for success, or at least help adjust your expectations of what to prepare for, right? I say this time and time again. Oftentimes, people coming from different countries, even here in this country still, mental health is such a taboo topic, right? And so to talk to a stranger like myself for the first time and tell all your business can be extremely difficult. So I want to acknowledge that. I want to say that's a normal experience and it's okay to experience some levels of anxiety. So without further ado, let's jump right into it. So like any psychosocial assessment or psychological evaluation or forensic evaluation, those terms are pretty much interchangeable. We are, as clinicians, I'm observing a lot of the nonverbal cues, right? So I'm observing your behavior. I'm observing your presentation. I'm observing, how you respond, your tone of voice, how you're presenting, your affect. I'm looking at all these different type of things because this is also going to tell or support a narrative around a potential diagnosis if a diagnosis is there. I won't say it's not a must that you have a diagnosis, right? Sometimes the presented symptoms don't necessarily align with a diagnosis, and sometimes we have to reassess and reevaluate. That's something that I would document in my report for you if that is something that I find. So just keep that in mind. Also, I'm going to ask questions about suicidal ideation, either past or present, right? And so suicidal ideation is essentially having thoughts of wanting to harm yourself, having thoughts about not wanting to be alive. And, sometimes that happens for a lot of reasons. Sometimes we're under a tremendous amount of stress. Sometimes life just doesn't seem to be fair to us. Sometimes you just don't want to be here. And so, with suicidal ideation, it can be active or it can be passive. And part of a good evaluation, the therapist, the evaluator will be able to assess whether it's passive or active. And if it is active means that it's present, it's right there, you're feeling those feelings right now. Developing a safety plan, and also recommending that you follow up with the crisis unit or the local emergency department for further support, right? Because at that point, safety is always and will always be a top priority for us as licensed mental health professionals, regardless of your licensure. So from there, we're going to get some understanding of the background, right? Family dynamics, some details about your birth of origin, just background, kind of understanding the contextual and understanding sort of what was going on before this stressor kind of precipitated, right? Before you were met with this stressor. And so that's really helpful for us to understand like what is baseline for you in terms of like your mental health versus like, when you're exposed to this really stressful situation, how you're responding to that. So we'll do that. We'll get lots of information on that. The other thing that we want to take into consideration is, do you have a history of mental health concerns, right? Were there some issues? Did you see a therapist maybe in your home country? Did you see a psychiatrist? Were you on medications for depression maybe in the past? Those type of things help us understand, again, baseline, right? Baseline is really important. Baseline versus like presenting symptoms kind of helps us make the case, or kind of helps us make the argument, if you will, regarding how your mental health is declining, all right? How your mental health has been impacted as a result of this current decision, or potentially losing this person, or you being the person potentially getting pulled away from your loved ones. So the other thing to kind of take into consideration is also financial considerations, education, if that's applicable, personal considerations. Personal considerations can be, maybe you were a full-time housemaker and now as a result your husband's getting deported or facing deportation, and how that's going to impact you and, your stability, right? That's directly going to impact your finances. So all those things, all those considerations can impact your mental health, right? Can impact your ability to manage stress. And so those are the things that we want to know about as evaluators, right? And those are the things that are going to be really important to share with your evaluator as you're going through the process. Other things to kind of keep into consideration, I've mentioned this in my previous videos before, especially for pretty much any psychological or mental health evaluation for the purpose of immigration, we're going to give different mental health evaluations, right? And so we want to get a better understanding of how, not just necessarily get a better understanding, but sometimes it allows us to quantify how severe your mental health symptoms are. So oftentimes I'll send my people, these screening tools, I'll send it via email through my system, and I'll have them complete it before the session. That way, it's fresh, it's new, and I'll have that information going into the session. And then I might have to have you do it one more time just so we can kind of get a pre number and a post number, and we can average that out and get, kind of quantify that number and give it to, or add it to the report rather. So that's really important. The other thing to expect or be mindful of is also that, we may potentially give a diagnosis. A mental health diagnosis isn't necessarily a bad thing, right? But it can help make the case in terms of like, this person has really been going through it. This person is actually clinically depressed, right? I'm giving this person a diagnosis of depression because everything that this person is going through, it's impacting their ability to function socially, to function at work, to function for their family. And that's how we justify a diagnosis, right? We tend to look at the different aspects of our lives, right? Social, emotional, occupational, and we look at how, whatever the stressor is or whatever that change is, we look at how that's impacting the person or their ability to get out of bed, something so simple, or, a typical routine, brushing your teeth, cleaning up. And we look at how that can change, or that looks so much differently or shifted so much. And so we can talk about it from that perspective. And so giving that diagnosis helps make sense of all these symptoms, helps make sense of everything kind of going on. And so we can add a diagnosis into the report for the individual. And what I would do from that end is to kind of give criteria for that diagnosis. And what that means is like, here are the symptoms that this person reported to me, and this is how this justifies this diagnosis, right? And so again, also specifying the symptoms that I described and how it's impacting you, right? Because again, we want to tie it back to this hardship. What is a hardship you're facing, and what is the mental health impacts or implications as a result of this hardship, right? So if I'm saying, and I'm using the example of like you're a homemaker, your spouse was the provider, this person's getting pulled away, I can, make the case, or at least I can argue, if you will. I'm not a lawyer, I'm a therapist, but we can make the case as saying that this person, because of that abrupt change, right, not only just for the mother, the children also, adjusting. And sometimes with an adjustment disorder, we can have a depressed mood, we can have an anxious mood. And so the difference between an adjustment disorder and like a major depressive disorder and a generalized anxiety disorder, all these different diagnoses, but it's the time, right? It's the time frame and the intensity. So that's why it's so important to give, if you're noticing like, oh man, I just can't get out of bed, and you're noticing that's persistently happening, I would encourage people to take notes or write in a diary or just kind of just take mental note, right? If you have the capacity to. Sometimes when you're depressed, like you just don't have the energy to do anything. And, you can tell that to the evaluator. You can tell that to me, and I totally understand. And then most importantly, we have to tie this all into the hardship, right? What ways would you as a client face hardship if they remain in the United States without that family member, right? My job and your job while you're meeting with me is to further explain that, right? Like, again, we go back to the example. You're a homemaker, your partner was the main provider, and this person gets pulled away. That's financial stress. You possibly face an eviction now too because this person is in processing. That is homelessness, right? Or, all these things impact us psychologically, right? And so we have to be able to speak to that. And so it's up to you as a client to clarify what that might look like. And maybe you don't have full details of what you're about to face, but you know what you feel inside. And so that is just as important, equally as, applicable in this case, to kind of help us understand and make the case that this person is going to really struggle. This person is already struggling, but without this person, if this happens long term, this person is going to continue to sort of spiral, right? This person is going to continue to decompensate because they don't have the skills, they don't have the finances, they don't have the community to support them, they don't have access to mental health services. And so all these things that we can put together to kind of help the judge or the immigration, your attorney also to make the case that, this person is going to face this hardship because this person is removed and it's going to impact their mental health. So in summary, we just want to highlight for you as a client, all the ways in which this hardship or how this hardship looks like for them and how it's impacting their mental health if their loved one was to leave or if their loved one was to be removed. And so we want to make sure we also include the current mental state, right? So like if you're, I gave the example of not being able to get out of bed for the past couple of days. Tell me about that, right? Tell your evaluator about that. That's really important for us to know because that's speaking to your inability to function. And that's not a moral flaw or like a moral deficit. That doesn't mean that you're a bad person. That just means you're having a really hard time. You're struggling. Your mental health has really been impacted. And so those are the things that we want to hear about. Also, something to know that, oftentimes I give my clinical recommendations towards the end of the report where I'm recommending that, more than likely I'm going to recommend that you get therapy. Now, because oftentimes when people see me for the evaluation, that does not necessarily mean that I am your therapist, but I can help you kind of get aligned with a therapist in your area, in your state. But I often recommend therapy. I often recommend some levels of community and support, and that's not always realistic for everybody in their circumstances, and I totally understand that. And again, it's going to be a case-by-case situation, but those are definitely generally some of the recommendations that I would make. And then I would wrap up by just kind of adding some sort of recommendation on what it is I think is the best sort of psychological or psychosocial approach to support this client in this potential hardship. So that goes back to the recommendations regarding therapy, community, and things of that nature. So all in all, to say that the goal of this hardship, mental health evaluation, or how this mental health evaluation can support your hardship cases, is because oftentimes these are abrupt and sudden changes, and they really impact the family dynamic in more ways than one. And whether you recognize it or not, whether you're able to point a finger at it, it's going to impact your mental health, right? And so as a mental health professional, we want to be able to help speak to that, right? Because that can help the judges, whoever reviews these immigration cases, help really understand this is going to have a really significant impact on this individual and their mental health. And so, Yeah, that is the hardship case, or hardship waiver, if you will. And if you are somebody that's applying for hardship, and or maybe you've been advised by a family, a friend, an attorney, hopefully, but I understand that's not, people have the right to pursue this immigration process without an attorney. And if that's something that you are interested in doing, and you want a mental health evaluation to support your case, make sure you reach out. And if you have any questions below, from my perspective as a mental health professional, drop your questions in the comments. And then until next time, I will see you, and take care.